Hello, today we're here to talk about the proactive milieu service. Here in our residential program, we deliver the milieu service by developing a treatment plan. Our treatment plan comes from some core concepts. We look into the student's history, we look at the presenting behaviors, we look at their diagnosis, as well as other factors, such as ADL skills or things that we want and the student wants to achieve for themselves in the future. Through these core things, we develop a focal treatment plan. From the focal treatment plan, that is where we develop our milieu proactive service. In the next section of our video, you're going to see two people that depict a proactive service that's happening. One of the staff are depicting a staff, and the other person is depicting a student.
Hey Jenna, so I'm sure you probably heard today we are going to be able to go off to Six Flags this afternoon. Do you want to go?
Well, I really want to go, but I'm really nervous.
Well, that's understandable, but hey, I have an idea. How about we come up with some sort of plan that can help you bring down your anxiety and make sure that we can keep you safe during this trip off grounds?
Okay, well, I'm really anxious that when we get there, that I might get lost.
Well, let's start off. Let's actually do your coaching plan to kind of bring down our energy right now so that we can actually talk about it. Does that sound like a plan?
Okay.
I actually brought it right here. All right. So, where's your energy right now?
Hi.
Yeah. Hi.
And I feel uncomfortable.
Well, why?
Because I feel like there's going to be so many people there, and big crowds just make me feel like anxious and like I might not be able to stay with the group.
Okay. Well, what's some ways to kind of bring down that anxiety? Maybe some deep breathing, maybe? Does that help you sometimes?
Yeah, sometimes.
All right, do you want to, maybe we can practice that after when we get down to practicing our skills down here?
Okay.
Yeah? So how are you feeling? Are we a little angry, happy, scared, worried, depressed, silly, sad?
I'm feeling scared and worried.
Okay.
But I also feel happy because I get to go on this trip and I think it's going to be fun.
Yeah, well that's perfectly normal. All right. So so far, how's your day going? Are you having a pretty good day?
Okay.
Yeah. All right, so we just talked about a couple coping skills. We were talking about deep breathing, and this is a great time to practice it. You ready to try that?
Yeah.
All right. All right, count of three. Breathe in through our nose and out through our mouth. All right, we'll do that 3 times. All righty? 1, 2, 3. And one more. Awesome job. That was good work. So, just to kind of start off, what's a positive thing that you've done today?
Well, I used my words to tell you how I felt.
That is great. I'm really proud of you for doing that. All right. Last part. Where's your energy? Is it increased, decreased, high, low, medium? Where are we at?
I think it feels medium now.
Medium. Great. Still comfortable or uncomfortable?
I am a little more comfortable now.
Okay. All right. Now we got this done. We talked a little bit about a coping skill that we're going to use. But as you expressed that, hey, there's going to be some large groups there. And I can understand that might bring up our anxiety a little bit. And so what I suggest is that, you and a couple other of your peers could come along with us. And, we could kind of, practice our coping skills. So if things get a little bit too anxious for you.
Well, what happens if I get really anxious and we're walking around in a big group?
Well, like I said, we can, separate with you and your other peer. We'll come up with maybe even a code word to kind of say, hey, Ryan, I need some time alone or I need to take a break.
I like the code word.
All right, well, what word would work well for you? I know maybe Bailey or Bam Bam, what word would work for you?
I think Bailey would work because the program's therapeutic dog really helps me calm down sometimes.
Great, I like that idea. That's a perfect idea. So maybe what we should do is we should practice that. So on the count of 3, I'll say Bailey, and then we'll just do just exactly what we did, or we'll practice our deep breathing, kind of take that time to center ourselves, and then we can continue on. How's that sound?
That sounds good.
Awesome. All right. So on the count of 3, Bailey, and we'll breathe, right?
Okay.
1, 2, 3, Bailey. One more. Awesome job. So, does that think that will work for you?
Yeah, I feel better about going to Six Flags now.
Great. And if we need to take some breaks, or we need to kind of come up with a schedule where we do 3 rides, take a break, get separate from the group, that is a great way to kind of help you along through the afternoon.
Awesome. I can't wait to go to Six Flags now.
It's going to be awesome. Let's do it.
Hi, my name is Joel Miners and I work in a level 2 group home and I'm a licensed professional counselor. I'm here to talk to you today about how we go about the process of going from a referral to a treatment plan. The first process is we review all the documentation that we have and we contact the client's DCF worker / guardian depending on what the situation might be. And we are trying to look at what has been helpful for that client in the past and what things haven't been helpful for that client in the past. At that point, we're going to schedule an interview where we can meet the client at their current placement. Myself and usually my supervisor go out to meet the client and we discuss with them what their goals for treatment are and what they see themselves doing in the future. So we're looking at what kind of things are helping them to develop more independence, how they cope with stress, and different types of interpersonal skills that they're trying to develop. After that, we go back and we have a discussion and we see how the client presented to us and what goals we think that they need to work on. And after that, we schedule another interview where we have the client come out to our specific program. And the purpose of that is to have them kind of see the environment that they're going to be in and meet the clients that they're going to be spending time with. So we have the clients kind of tell them about the program and the things that they like and the things that they dislike. And then the client has an opportunity to ask questions and get an idea about what kind of things that they would like to see happen when they're there. After that, we have another meeting where we just kind of discuss that over again and we see what we think about that process. After that, we're ready to sort of form a kind of a skeleton treatment plan, a basic bare bones treatment plan that covers the goals that we think needs to be addressed and includes the client's input. After that, we have an intake where all of the necessary parties are involved, including our staff supervisors, clinical supervision, psychiatrist, and staff nurse. And then we go through a process where we ask the client what kind of things they need to work on again, and we go towards trying to plan for those things. After that, we have a staff meeting where we kind of introduce the staff to the client and tell them all the information that we've gathered and for the treatment plan goals that we've developed and how the milieu interventions are to take place after that. This is a process that we revisit over and over again throughout treatment, and it's something that is changed depending on the circumstances that come up.
program supervisor for this level 2 group home. My role with the PNMI Standard 31 is to review notes after staff have written those. When I review those notes, I look for making sure that the interventions were proactive and making sure that actually the place where the intervention took place, that the actual intervention for that date is the one that they're writing on. I also look for a response from the clients as they going through the intervention, where there is a back and forth type of interaction between staff and the client. I also make sure that the client is in a learning mood, that they are in a mood to be able to cooperate with the intervention, so it's a positive interaction. I also look for the response from the client and making sure that they talked about whether these interventions were helpful or not helpful to them for the matter, and whether they're going to use that skill in the future, which is an important part of the session for the boys. I also look for the amount of time that was used for this session, which should be a minimum of 15 minutes. Once that's done, I just take notes about what those notes look like and bring this stuff into a supervision type of a setting. We talked about the areas they have done well writing those notes, and then the areas that they might need some help with. We can make some corrections if it has to do with any type of role play that might have happened and they did not put those details in there, and then we could do that part of it. During that time, the staff could ask questions, any concerns. Once we finish with that, at times we might be able to do some type of mock type of note to train them how to do those notes properly for the future. After that happens, we will meet again after that staff writes the next million note. I will review that note and then I will get back to them to let them know, give some feedback about the improvement that might have happened during that, the next session. And then after that, we'll continue to meet weekly. What happens is if we stop the meeting sometimes, the notes will go back to being kind of needing some work. So I try to keep meeting with them as much as I can regarding million notes writing. And that is what I do, that is my role.
In our monthly trainings, I try to teach the staff on how to deliver the service according to the standards. So not just how to write the note, but how to actually deliver it. One of the main things that we focus on is a proactive versus reactive intervention and what that means. So we always encourage the staff to catch the client when they're at their best, when they're in a good mood, they're cooperative, kind of willing to learn, and they're open to coaching, versus when they're in distress. Because at that point, I always say the client is not really listening, they're not using their critical thinking, they're just being reactive. So that's a really, really important aspect of actually delivering the service, and that's always what I start with in all of my trainings. Sometimes we'll go through examples of, what was something that was reactive versus what was something that could be proactive, just so that the staff understand that better. The second part of the note that we really put a lot of focus on is what the client said, how the client responded. I always say to the staff that it's great that they, deliver this intervention and that, it's lengthy and they use a lot of detail, but equally as important is what the client said, how they responded, how the intervention actually helped them. So we always, ask the staff to, if the client is not willing to really talk about it or is given sort of minimal answers like, oh, I thought it was a good intervention, or yeah, it was probably helpful. We have questions, they're open-ended questions that, prompt them to answer in a more extensive way. So questions such as, how did this intervention help you? How do you think you'll use it in the future? What did you think about it? Versus questions that are more yes and no answers that prompt yes or no answers. So in that way, the client really does have to expand on, his reaction to this training. Obviously I encourage the staff to try to remember as much as they can from the client's response. Sometimes the staff are actually even able to quote the client and what they said in the note. So the more detailed, the better.
Now we will role play one of our examples of a service milieu note. I will be portraying the client and Kelly will be my staff. We will work on Kelly teaching me effective communication skills, and we will role play regarding a difficult morning I had with interactions with staff.
Hi, Rena. Hello. Ready to do your goals?
Sure.
Okay. So, do you know what your goals are today?
I think communicating.
Yes. What kinds of communication are you working on?
Effective.
Okay. Do you know which other kind of communication you're working on?
The other one, so like not the effective one.
Okay. What's the word for that?
Ineffective.
Very good. So how was your day today?
It was good.
Yeah.
I went to school. Yeah.
How was that?
It was great. I got to see my boyfriend at lunch.
So how was your morning today?
It was good. Staff got on my nerves, but other than that, it was good.
What happened?
Well, I was straightening my hair in the bathroom, and they kept calling me for meds, and I wasn't done. And so basically, I got an attitude, and I swore at her.
Okay. So you were being called for meds.
While I was in the bathroom,
How many times did they call you?
like 2 or 3 times.
Oh, wow. So it sounds like because you were called so many times, it was kind of annoying for you?
Yes.
Okay. So after you went back, though, to go take your meds, how did your interactions go with the staff?
Well, I didn't talk to her because she had annoyed me, and I was frustrated, and she was trying to process with me, and I wasn't ready. So I cursed her out, and I took my meds because I wasn't going to refuse my meds, and I left for school.
Okay. So just to kind of summarize, so it sounds like you were getting ready for school. You were straightening your hair.
Yes.
Getting all prettied. Okay. So you were called several times, and then you went to the back, and you took your meds, and then you kind of had maybe a negative interaction, not so positive with staff?
Yeah.
Okay. So because you just told me that you're working on effective and ineffective communication, can you tell me maybe what kind of communication that was that you had with the staff earlier today?
Well, I guess it was ineffective because I cursed at them, but they were frustrating me.
Okay. Did you have any other interactions before you left for school with that staff?
No.
Okay. So what I want to kind of ask you, how many times again did you say you were called?
Like 2 or 3 times.
Okay. So they called you, and when they called you, did you maybe give them a response?
No, because I was doing my hair and I was gonna go take my meds and I heard them. I just wasn't ready that second when they called me.
Okay. So I want to try something.
Okay.
So say that everyone else is out of the house for the evening. Some of your peers have independent activities. So you and I are kind of hanging out. And I'm upstairs in the office and you're in the living room.
Okay.
So we're fairly close to one another. So you need something, so you give me a call.
Okay.
So go ahead, why don't you call me?
Kelly,
Okay. And you hear?
you're not saying anything.
What might you do next?
I might get upset. I'm like, Kelly,
And you hear?
nothing.
Okay.
Oh, then I'll be really mad.
Okay. I don't want you to get really mad. But what might you do next? Would you call me again, do you think? Or would you come find me?
No, I will come find you.
Okay. So in that moment, can you maybe explain to me what you might be feeling when you call me and I don't respond?
Frustrated, annoyed,
Okay.
like you're ignoring me.
Okay. So that might be kind of the connection that you're calling me, but she's not answering me, so maybe she's ignoring me.
Right.
Okay. So I want to connect back to your interactions earlier this morning. When staff called you, did you give them any response?
No.
Okay.
Because I thought I was going to be right there,
Okay.
but then they called me again.
Okay. So, do you think maybe we can try by doing some role playing of maybe how we can turn it into an effective communication?
Sure.
Okay. So, you want to be you?
Sure.
Straightening your hair?
Yes.
Okay. And I'll be the staff that was on this morning.
Okay.
So, I'll call you. Irina, time for meds.
I need 5 more minutes.
Okay, good job, good job. Okay, so I give you 5 minutes, right? So let's say 5 minutes goes by, okay? You're still straightening your hair?
Okay.
So I call Irina, it's been 5 minutes, time for your meds.
I'll be right there.
Okay.
And then I'll be right there because you already gave me 5 minutes.
Okay, so I want to make sure too that you're also still getting what you need. So if you need another 5 minutes,
Then I'll say, like, can I have 5 more minutes, please?
okay. So how did that feel doing that?
Good.
Good. Okay.
I don't feel as frustrated as I did this morning.
Okay. Do you think that that might be helpful?
Yeah.
Okay. So maybe, and you could see the kind of the difference and maybe the importance of kind of giving the response. So letting someone know, that you do hear them, and but making sure that you're also advocating for what you need too. So letting them know that you need 5 minutes, and then just kind of calling them, letting them know again if you need another 5.
Okay.
All right. So you think maybe this is something that you could use in the future?
Yeah, tomorrow, because I plan on straightening my hair again because I'm gonna wash it. So tomorrow morning, I can do that if they call me and I can let them know.
Okay. Good. Well, good job.
Thank you, Kelly.
Do you have any other questions or anything else you want to talk about?
No.
All right. Thank you.
Hey Cal, I know it's the end of shift change, but I'm confused about Irina's goal. Can you tell me how you're going to write it up?
Sure. So we know from her reminder sheet that lists her goal and what the objective is. So if you look right here, her goal is that she will increase effective management of trauma symptoms by increasing her awareness of appropriate boundaries and relational skills. And the objective is that she's going to identify and implement themes of effective and ineffective styles of communication 2 times a week.
Okay, so we're actually doing this goal with her twice a week.
Yes.
That's part of what, so I can still do it with her later in the week, even though you did it tonight.
Right, and it will may be helpful for you to maybe read through the note that I'm going to type up so that maybe you can see what her and I talked about, and maybe you may be able to use, maybe the situation or review a couple of things and then teach different skills.
Okay, so like when we're setting up the shift, if I know I have her, I'll just flip back through and we'll get your note.
Right,
Okay.
right. So if you want, I can show you the questions and kind of go through them. with
Yeah,
you.
thank
Okay.
you.
So first you start with her progress. So I'm going to note that her progress was significant because she was able to engage with me. She was able to be appropriate when kind of expressing, what she needed.
I didn't hear her yelling from the other room this
No,
time.
she didn't.
Okay.
And kind of when we were going through practicing the skill, she did an excellent job at role playing, kind of taking kind of accountability and kind of showing me how she's going to be assertive and advocate for what she needs the next time.
Alright.
So she was able to go through the whole process and did very well.
Go Irina.
Yeah, yes. So then next you would look at the overall progress. So for this, I normally, again, kind of note, kind of what I just said for her significance. So kind of noting why her progress was significant
Okay.
and kind of hitting just a brief kind of summary of why it was significant. So again, she planned with me proactively when she was going to meet. When I asked her if she was ready to meet, she did a great job. She kind of stopped what she was doing. She let me know how her day was, and then we kind of went through the whole process.
Okay.
So just kind of like, again, an overall review of why her progress was significant.
So if she hadn't done some of those things, it might have been partial or minimal?
Yeah.
Okay.
So maybe, for example, if I asked her kind of what her goal was, and it was like, I'm not sure, I don't know. So again, we can provide the hurdle help for her to kind of, walk her through it. But if you get a lot of, I'm not sure, I don't know, sometimes you may get, I don't remember, kind of things like that. So she was engaged, though, I would say fully, and she did a really nice job.
Okay.
All right. So next we go to what skill was taught. So again, because, she's practicing skills for effective communication, her and I kind of spoke about responsiveness towards staff, to staff, and kind of being assertive, but again, appropriately, and we did that by role playing.
Okay.
Okay.
So if she still starts swearing in the morning during meds the next couple mornings when I do her goal, maybe should I talk with her about aggressive versus assertive? You guys haven't done that yet, have you?
Nope.
Okay.
So maybe, yeah, that might be helpful. And again, for some of the things, you can look back at the interventions that you would use because that's helpful to kind of help, you know, in getting started with teaching the skills.
Okay.
So we use role playing to kind of show her how to appropriately, you know, be assertive when letting staff know what she needs.
Okay.
So after kind of hearing Irina's, you know, kind of perspective and again, validating her feelings, things like that, I use some psychoeducation to kind of educate her on the responsiveness piece
Okay.
for effective communication. So,
Oh, so that's like the relational piece of her goal.
right.
Okay.
Yep. So the appropriate boundaries and
okay.
relational skills.
All right.
So we kind of talked about her interaction this morning with staff and how it went, and she identified that it was an ineffective communication. So then I used the psychoeducation piece to kind of express and, you know, explain to her the importance of this piece of the goal with the appropriate boundary.
Okay.
And I had her kind of, we kind of switched roles. So I had her calling me similar to her situation, and I asked her how she felt when I was answering her. And then we kind of went into how we role played so that we showed the effective communication.
Okay.
And that's where she then practiced appropriate relational skills.
Cool. So it's okay to just ask this last question about, like, after you do all of that with them, just say, when can you use this skill?
Absolutely.
Okay.
Yep. And it's helpful. Again, it's nice because normally when you kind of go through it and you teach it and you do the activity, again, the role playing for this example, it was nice because right after I asked her, and when can you use it? And because it connected so well, she was able to tell me that she'll be able to use it moving forward the next morning, which was our situation that we discussed. So she was able to let me know that what she's going to do moving forward is work on that engagement piece with staff by letting them know what she needs.
Okay. So if I got through all of the goal with her, but we got to the end and I asked her when she could use the skill, if she didn't know, it's still okay for me to give her examples and I can still give her a significant because she did the rest of
Yeah,
what
and
she
I
did?
think
Okay.
sometimes it's helpful if you give maybe some suggestions to them and encouragement to use it in the context that you maybe, for example, role played in the note. So you can say to her, well, we role played in this situation. If you think that you might encounter a future situation like this, would you use it then? And then sometimes they might kind of hear your suggestion and then give you some more of their own.
Okay.
So that's usually helpful too.
Thanks.
You're welcome.
So, Cal, I'm sorry. I know you're still typing, but I have another question for you.
Sure, go ahead.
I realize that I'm taking Irina on a visit to her grandmother's tomorrow. And if I end up getting her for goals, I'm wondering, is it something that I could still connect to, like maybe when she's visiting her grandma and how she interacts with her grandma? Because I know our clinician told us that she really likes to kind of yell at her grandma sometimes. Yeah.
Yeah, absolutely. Because again, you can go back to focusing on her appropriate boundaries and relational skills. This is in kind of like in general perspective, so not just in the house.
Okay.
So this could be her practicing exactly what you just said when she's on visits with her grandma, interacting with other peers and teachers while at school.
Okay.
So definitely, she could definitely do that while she's at her grandma's. Did you have anything specific in mind as to how you might kind of discuss and practice it with her?
Or I think I wasn't sure because I know she's not staying overnight with grandma yet, so she won't be doing her hair, but sometimes when they see each other just for a short period of time, it's hard. And so that relational piece, I just wanted to prepare for, tomorrow if,
Absolutely, she can.
Okay.
All right.
Thanks.
You're welcome.